Vice President Mike Pence making a weekend pitch to repeal and replace Obamacare. Insurers and drug companies are applauding the plan, and that's exactly why some here say patients and taxpayers should be worrying about the plan. It's time to debate. Hi, everybody. I'm David Asman. Welcome to Forbes on Fox. Let's go in focus with Steve Forbes, Elizabeth McDonald, Bill Baldwin, Sabrina Schaefer, John Tamney, and Bruce Japsen. We got a full house. So, Emac, a lot of people in Congress are saying that this is helping insurers more than it's helping patients. What do you think?
I agree. Even though I said last week that, yes, we need to get this reform done, it does seem to help companies more. Listen, when have you ever heard the government say, yes, insurers, you're allowed to hike insurance prices 30% for if you go without coverage for a year? When have you seen such corporate entitlement built on tax credits like this plan is? I get it. We need Obamacare repeal and replace. It's very difficult to do, but this does seem like a boon for the insurance companies.
And Sabrina, there are a lot of tax breaks for the insurers in this thing. We can put them up on the screen. I mean, it does help them out in specific areas.
Yeah, David, look, I mean, I think we have to think about this along a spectrum of sort of good, better, and best. We may not be at the best plan just yet, but I think we are moving in the right direction. And I think a lot of Republicans are working to sort of repair some of the most damaging parts of Obamacare and using things like tax credits and trying to equalize the employer versus individual tax situation is very important. If government is going to be involved at all in subsidizing, I think it's important that they are not subsidizing health insurance, but that they are subsidizing health care, and that's the direction we want to be continuing to move in.
Well, and Bruce, the definition of crony capitalism is really helping out a small group of businesses and everybody else pays for it. Is this an example of that?
Oh, it certainly is. I mean, you have the situation with these insurance companies. I mean, a lot of people, Paul Ryan and Donald, have brought up this whole idea that Obamacare is in a death spiral because of what the Aetna CEO said. But the reality is, his company wasn't able to successfully manage the costs of care. They pulled out of Florida, but Florida Blue Cross is in it. They're making money. They screened all their patients, and they've got 800,000 customers. So this is now, they're going to get to sell what they want, and it's not going to cover benefits and charge what they want. That's not going to change.
Steve, there's a phrase inside the Beltway called carve-outs. There are a lot of carve-outs. Again, this is a work in progress. It may change, but does this concern you?
Not so much, David. On any bill, you're going to have interest weigh in. The surprise would be if they didn't try to weigh in. The key thing is you have more flexibility in the markets. You get less of the discrimination between young people and old people. Young people having to subsidize old people. That goes down a bit. And so it gets a C-, but it is a step in the right direction.
John, you're no fan of crony capitalism. What do you think?
I'm not, but at the same time, anything that's good for insurance companies and drug makers logically is probably pretty good for consumers. I think we've got to remember that only in Hollywood do companies get really rich by fleecing their customers. In the real world, they get rich by bringing value to them, and so I think we have to keep that in mind. Insurance companies aren't bad. Drug makers aren't bad.
All right. By the way, it looks like you're in Hollywood right now, so you know. Bill, what do you think? Is this crony capitalism, or will this help the individual patient and taxpayer?
I think Ryan Care is just as bad as Obamacare. I think if we want to help patients, we've got to eliminate those ridiculously high deductibles, make them all zero, and bring in high copays. Let's just say 50% of the first $8,000. And then and only then would patients be motivated to shop for the cheapest MRI.
Right. Steve leaned in on that. Go ahead, Steve. What do you think?
That's preposterous. The government should not be dictating these things, and at least this bill starts to move in the direction of taking some of these restraints off and not get in the trap of throwing people out on the street. And so mandating this, that, or the other thing, you want to get more of an individual market. And by the way, that 30% premium, if a young person drops out and then goes back in, that's not good, but it's far better than the individual mandate that covers everyone. And this was a sop to the insurers to get a real reform.
Emac, at least what this one thing this bill does to empower the individual is it increased health savings accounts, and it also increased the flexible spending accounts, so you can put more of your own money tax-free into your health care.
Yeah, I get it. I hear what you're saying, but, you know, the insurance companies have not behaved so great here. Watch this. The raw-knuckle power of the insurance industry at the state level. Obamacare already had in it the ability for states to create their own health compacts. It's in Section 1333. I know I just sounded like the scarecrow we just got a brain, Section 1. But it allowed for states to build their own pools across state lines. Rhode Island, 5 states were doing it. They tried to do it, but the insurance lobbies are so powerful at the state level, they stopped it. So a true free market cannot happen until you remove the insurance company's ironclad grip at the state level.
And Sabrina, I know this is a step, or maybe a step in the right direction, but at the same time, it was the insurance companies and the drug companies that were in there at the beginning of Obamacare. They got their little carve-outs there. Shouldn't we be suspicious of them getting more carve-outs here?
Right. No, I mean, I think we all knew during Obamacare that, if you sort of get in bed with the devil, that's what you get. And I think, but I do think that Bill sort of was saying, it's two sides of the same coin, in my view. I don't want government to do this, but I think that what Bill was pointing out is that we want health insurance to be for catastrophic injuries and instances. It shouldn't be for paying for that average doctor's appointment or getting a strep test. That's where people should be, shopping around and making sure that, and it would naturally come down because you would simply have more competition. We already see that with things like the minute clinics that are popping up all over the place. We want insurance to really be that traditional insurance, not the everyday
Bill,
use.
go ahead.
I think we've really got to empower the patient. It ought to be possible to go onto your computer screen and shop for doctors or MRIs the way you can now shop for blue jeans on Amazon.
Yes.
And we can't do that now. Why not? Let's fix that.
John, what do you think? Can we fix it?
Well, of course we can fix it, but let's get rid of, if we're going to be suspicious about insurance companies, let's be suspicious about a Republican or Democratic Party that would want to legislate what is a market good. If this is about getting health care or health insurance to people, just free up the economy.
Come on,
this
John,
is
you're
easy.
missing
It's a
the
market
point
good like anything else.
John, you act like insurance and the companies are discreet from, and they don't do any lobbying of politicians in D.C. They go hand in glove together to craft legislation like this. And so I'm saying it's not truly free market reforms when you have guys sitting at the table crafting legislation behind the scenes that hurts everybody.
John, quickly.
Well, no one's saying that it's good or bad, but if we want to fix this, it's not about letting Congress do it without the insurance companies. Get Congress out of this altogether. You'll see a great outcome.
Bruce, I heard you mumbling. Go ahead.
Well, the people closest to this, closest to the patients, the hospitals, the doctors, and the nurses are all opposed to this. And the insurance companies and the pharmaceutical companies have not said anything this
Steve,
week.
speak to this, because there are these associations. Bruce is right. There are these doctor associations inside the Beltway that claim to speak for all doctors. But frankly, there are doctors involved in this. What the secretary who's involved most closely in this is a doctor. Rand Paul is a doctor. There are a lot of doctors that are working to make this happen.
Yeah, they don't speak for everybody, and they're the ones who gave us Obamacare in the first place, which a lot of physicians opposed and have done away with a lot of individual practices.
Yeah.
So in the real world, in terms of these tax credits, maybe after the negotiations, these tax credits can be made like school vouchers, where the patient can go on the market and start to get a real insurance market.
I would like to be totally in charge of my own money.
The House bill is a step in that right direction.
Yeah.
I hope they tweak it a little bit. Then we're on our way to a
Bruce,
real free
I just
market.
want to check your consistency. When Obamacare passed, were you against the carve-outs for insurance companies back then? Because remember, they got a whole bunch of subsidies.
I was not wild about what happened then. I mean, they needed to get something through. What you need to do is you need to amend this. And I mean, the insurance companies, they won on this. You got to understand, they're making billions of dollars off Medicaid, Medicare.
Yeah,
they
are making a lot of money. We got to leave it at that. From replacing Obamacare to cutting taxes.